Nope, I have to request that from the host. Sarah, that's you. Oh, great, recording, perfect. All right, welcome everyone. It is May 12th and we're here on the COVES webinar today to start talking about plans for reopening. Now, that's not making any assumptions about timelines or anything else, but as we've been preparing for the future of COVES, one of the themes that's definitely come up has been what will COVES look like when museums do reopen at any point in the future, and what steps can we take right now to ensure that we're meeting the needs not just of our sites, that's all of you, but also our visitors. So in thinking about that, we have a couple of topics that would be great for discussion. I know we have brainstormed a little bit. I'm sure you have all had conversations either internally or started poking around about that we'd like to engage you all in. So those three topics are suggestions for changing or modifying the data collection protocol to ensure that all of our visitors feel comfortable, our data collectors feel comfortable, and we're still able to collect data. The second is, what changes could we make to the core instrument to start responding to some very immediate needs our institutions have around reopening, visitor safety, anything else that we're using for planning purposes once we have visitors on site. And the third, should we have time and interest, we'd start delving into some virtual evaluation. Many of our institutions have started pushing content online, some more than others. I think some of us have brought this up even last month about virtual prototyping, but right now we're thinking about virtual evaluation, and we'd love to start that conversation as well. Without further ado, let's just jump right into questions about data collection. So who has started thinking about data collection in a post-COVID world once museums are reopened? That's right, Julie, I got your email. Elisa, Yep, Rachel, I see some hands, I like it. I don't want to give away all of my answers about what I think would be great for data collection. I'd love to hear from all of you first, just with some general thoughts around ways that we can adapt the existing protocol to some of the new norms that I think we're going to be expected to have. So do you all have ideas around ways we can adapt to what we currently know? Julie, why don't you, or Brett, go for it.
Cool, yeah. Well, certainly, you know, in thinking about when we arrive at the point where we can even have an audience in the building again and can collect data from them, you know, we need to move, you know, our data collection to be as hands-off as possible and with a very visible sort of solution for sanitization, right? So like a kiosk or podium that holds up an iPad that we can still do systematic sampling for and ask someone to, you know, please participate in a survey and then direct them to something that they see has just been kind of sanitized. You know, that's conceiving of how we could, you know, keep what we've had going on continued in the future. But the biggest challenge is not adapting to those norms. It's adapting, obviously, to what's going to be a dramatically reduced staff who are going to be tasked with a lot more things. As we're emerging to what's going to be a smaller audience to serve and resultingly smaller budgets for all the departments because of the revenue shortfalls that follow.
Do you, by any chance, have an iPad kiosk? Does anyone have an iPad kiosk or stand that they've been using? Lauren, Jessica?
I will say really quickly, we've used stands in the past, but sort of abandoned them because they're not adjustable and they're just not as customizable to people. They can't move very easily as they want to follow their kids into the gift store and those types of things. One sort of big question on my mind is just when it makes sense to even collect COVES data again. Like, I always think of COVES as reflecting the average visitor experience. And at least for the first few weeks, if not months, it's not really going to be the average visitor experience, and how that's going to impact, like, obviously we need information, but just really thinking about what that information is and if what we were collecting before is going to serve us well immediately. Which I think was one of maybe your second question, Ryan.
Yeah, and I've got lots of thoughts about that, but I'd love to hear from everyone else because I think to Brett's point, both staff availability and visitor flow are going to play into that a lot. If your institution is anything like mine, they are already asking for visitor data about who's going to come back. So being able to respond to who is coming back will probably be very important for many of us. COVES is obviously a great way to do that, but you know, we're going to be figuring a lot of this out as we go. Certainly not the data collection protocols and some of those recommendations that we can brainstorm now and come up with guidelines for, but to some of those questions about when, you know, it's going to be touch and go across sites. Just to be clear, before we keep going with this conversation, is anyone reopened now? And or does anyone have an idea of when they will be reopening? Kailyn?
It's looking like we're going to probably reopen starting July. Is going to kind of be our reopen date. Thought processes wise on evaluations, you know, I'm kind of in the boat of we've lost a good portion of our evaluators. Like we're not quite sure time wise, you know, who's going to be able to do evaluation. I was thinking about, you know, disposable stylists or something like that. You know, something like that people could use. So that's kind of where I was. We also have like a counter that I was thinking we could put the iPad on to kind of make it as hands-off as possible, while still being able to maintain the social distance that we need. So that's kind of where we are in thought processes right now, but that's kind of what I was hoping to hear is like more about like figuring out a timeline, because like I said, our evaluators right now are kind of, they're iffy.
Yeah, Beth?
Yeah, a couple more thoughts on actually collecting data. We've done a couple of times, had people use their own cell phones, either putting up a QR code, or we've been able to do a text through Qualtrics. So text 123 to NHM, and then you can't do this survey in text, but you get a link then, and you click on and it can go to the browser. That would obviously require not having like the data collector first couple screens on the survey that says did the person. So that's one thing we've done once with an event and once with our 3D theater. And then thinking also about paper surveys. I think we've talked about this in the VSA group as well. Can you give people a tote bag with a clean pen, with just the paper survey, or with the paper survey and they can grab a clipboard? I don't know if you give it to them at the beginning or you give it to them at the end, say, please come back. And so they would keep all that and just give us the paper. I don't want to enter the paper data, but you know, that's another thing. And last thought, you know, something maybe more akin to just general comment cards where people could leave their email address and we could email them the survey later. So I don't know.
I like that. I have not even considered such an idea of people using their own devices. It sounds great. There's probably some systematic bias that like arrives there. Like we're moving pretty heavily to digital ticketing, hopefully, or like everybody buying their tickets online and not trying to change cash with us. And you know, we have got a bunch of ideas of like QR codes that are going to lead you to the ticket product that you're interested in. And I can imagine totally like a small poster board or something in the area where we're doing data collection, where you like hover over this QR code, it'll take you to the survey, and you do this all on your own device, contact free. That sounds great. Also, however, though, the people that are going to be like comfortable to interact with the QR code or even to do a survey on their phone systematically are going to be, I mean, demographically are going to be different from our overall audience. And so it might lead to some bias. But to be honest, there was bias in who's even arriving at the museum post-pandemic for like the first year, I imagine. And so really what this tells us about who our audience is under question, but it does tell us about who's returning most immediately.
I mean, we were tossing around the idea of the QR code as well. Excuse me, thinking about still having someone there to do the sampling, the randomized sampling, and invite people to complete the survey, but ask them to scan a QR code with their phone and then do it on their phone. We have done that for a couple of events, one in our OmniMax and one in our planetarium. Worked better for one than the other, but that had more to do with the program format than anything else, I think. So that was one thing we've been thinking about. The other thing my mind keeps going back to, which presents its own set of challenges, is prior to COVES, when we did our own exit surveys, we did them as interviews, which requires a different level of training for the person doing the data collection, which may be prohibitive for some institutions, but where the data collector asked the questions and recorded the response on the iPad. And so the visitor didn't have to touch anything. Now you have to have that conversation, so hopefully everybody's masked and all that stuff. And like I say, it does require a different level of training and whatnot, but that was something else that I had in my head as a possibility for thinking about how to collect the data. Yeah, I think, I mean, to go back to Jessica's point about, when to do it and what kind of questions do we need to be asking, I would think there's going to be a lot of interest in being able to compare who's coming post-pandemic with who came before. So having a number of those questions still be comparable is going to be important. And I'm anticipating that there's going to be a lot of how fast can we get the data? And yeah.
I wonder what data is going to be important, really, because, pre-pandemic, the good old days, I probably more frequently was looking at the experience data, right? Like how people were rating the various aspects of the experience, NPS, OER, and, like development wanted to know some demographic stuff a lot of times, for their sort of grant writing. Now, mid-pandemic, that demographic data has really risen to become very important for helping me understand how much of the other audience surveying that I'm doing online and via email right now to help forecast things like intent to return, like how representative is that? How much do our online survey respondents look like those who visit us in person? That COVES demographic data has come in incredibly handy these days. Now, post-pandemic, when we return, are we going to be very concerned about who's returning demographically, what they look like? I mean, it could inform some marketing. Is it going to be experience that we're really heavily looking at because we're changing things, making things distant, going hands-off and that sort of stuff? I do wonder what of the information is going to be particularly important or sought after this.
I think that's a great question, Brett, because I think my hunch is one of the new questions will be, do people feel safe? And however they define safe. We just ran an online member survey, and one of the questions was, what will make you feel safe? Which of these things, how important are all these various actions in making you feel safe? Similar to what I think a lot of us are doing or have seen. And so then the obvious follow-up is, do people feel safe? And which actions that we have taken help that? And so I could see something about that being really important. Just sort of trying to look at.
Hi, this is Rachel from the Minneapolis Institute of Art, and we're a free and unticketed institution. So we're looking at some major transitions into time ticketing. So everyone has a ticket, even if it is free, and incredibly limited capacity, which is a huge shift for us, kind of with or without surveying thrown in there. And I would say that for us, for the first time, that means that we will have contact information for most of the people who walk through our door. right now we don't have contact information for the bulk of our visitors. So the possibilities of administering a survey via email, this is the first time we could ever really contemplate that. It of course has, as others have mentioned, and ticketing has all kinds of equity and access issues along with it, and the surveys will reflect that and sort of shake that out. But we're also likely won't be in a position where we can require visitors to have masks, because that is also an equity and access issue, and it's a financial issue for us. If we require them and then we can't provide them, and we can't provide them sort of through however long we need to, and then deciding when we no longer need to require that has a lot of questions to it as well. So we are operating from the assumption that we are looking to limit staff visitor interaction really as much as possible, which is unfortunate because that is not who we think of ourselves as being, but is a staff safety concern. So at least at this point, I think as imperfect as it is, we're likely to lean into time ticketing as a way to administer surveys more than we are to try to return to a program on site, just because of that constellation of issues. And again, even with its imperfections, that's kind of where we're at.
I can hop again. Oh, sorry. Brad had me thinking we're also trying to move to digital ticketing. And maybe if that demographic data is really important, maybe we kind of separate the two and there's information we can get up front when you purchase your ticket, right? That's our reliable zip code data because we get your address. Maybe there can be a follow-up there if people are comfortable. And obviously buying a ticket is different than showing up, but maybe that's a way to get that very first who's coming up front. If you get their emails, we could obviously select random samples of those email addresses of people who came and send that out later. Yes, equity, who's going to respond, whatever, but I think it might be a little of take what we can get at this point. We always try to ask zip code, but it's way more reliable when it's purchased online. So there might be more of the need for that demographic and like very basic experience at the beginning, and then maybe some more of those detailed questions. Like, I don't really care what special exhibit they came for. I don't know if we're gonna have special exhibits, but I really wanna know who. So I don't know. I'll be quiet, just thought of it.
No, I was going to jump in there and say, one, is anybody else thinking about time ticketing or requiring people to purchase in advance to limit staff visitor interactions? And then for those of you who are thinking about this, but specifically Rachel and maybe Beth, who have kind of started that conversation, would you be census sampling to the extent that you have information on everybody, or would you be trying to pull a random sample of pre-purchase contacts to think about stratifying and randomizing who you're asking for data from? Have any of those conversations come up?
That's a good question. We haven't gotten there yet. Part of that, I think, hinges on the second half of the time ticketing sentence, which is with extremely limited capacity. We are looking at extremely limited capacity. So even the number of email addresses that we may have access to from a day or a week could be small compared to what we're sort of dealing with. So I'm really not sure, and we haven't talked about that piece yet because we don't really have any surrounding numbers in place, if that makes sense.
There are, even if I gathered an email address from every single person that came in the door, which, to be quite honest, I'm hoping to do, a random sample from that contact list is going to be very different from our systematic random sample in person. Shaking it out recently, the survey that we ran, which we hit our entire list, most of our list, anybody that didn't get hit with like another recent ask, like the Slover Lynette study or anything like that. My estimate is that about a third of our like audience demographic is really represented there. The people who will opt in to even allow your email system to communicate with them are positively oriented towards the organization. The people that will then open your email and respond to it, like click on a link and do a 7-minute survey, are very positively oriented towards the museum. And so, you know, I've got like these hyper engaged people responding to surveys, which is different. And it's clear that it's different when I compare it to the COVES data. And so like any notion of shifting out of like in-person sampling into like sampling from purchase contacts is going to neglect a major you know, proportion of the audience, not like intentionally so, but it's just like a function of switching in that way. So that's part of the argument I'm making internally for why it's going to be increasingly important that we maintain our in-person data collection. Even if it's like very hands-off and very like do it on your phone, do it at a kiosk, the sampling in building, even with all the modified procedures, is still going to be really important. Otherwise, we won't really know who our full audience is. We'll only know those who are hyper engaged, who are probably the only ones coming back anytime soon at NISI, at least.
Yeah, excuse me. That's definitely what some of the external research is indicating, at least right now. But pre-opening, you know, this whole idea of intent to return is very questionable, in my opinion. Before we transition to the second topic about what kinds of questions should we be asking our visitors, I'd love to hear from a few other voices on this call who haven't spoken up yet, either very small museums who might be facing a totally different type of situation, or perhaps institutions who are participating in COVES in the future, as in we got a couple contracts, but obviously those training dates in April and May never happened, and all of our timelines have shifted. And so this is all new to you, but you obviously know exactly what COVES is. And I wonder how you're conceptualizing beginning to do some kind of audience level data capture in this unknown future world. So if anyone wants to chime in, that would be wonderful. Yeah, Jenny.
I can speak to an organization that has just joined up for COVES and hasn't had any training or participated. We have about 175,000 visitors at Moxie in Santa Barbara. And I'm really rethinking this, whether this is an appropriate time to start, whether or not, again, with limited staff and how to do this. We have no data to compare in the past. So I'm really struggling with the idea of really embarking on this adventure right now instead waiting for 2021, because I'm not sure why to start now, and we can't even have you fly out yet, Ryan. So it's questionable for us.
Lauren, you should speak next, because I know, yeah, good.
I'm unmuting myself. So yeah, I'm at Space Center Houston. We're also a institution that's got a contract on the table, but has not completely onboarded yet, and we don't even have a data collection team yet. So right now it's all me. And I'm still kind of trying to figure out exactly how to get our team engaged with kind of regular data collection and understanding that having solid demographics that are based on a randomized sample is a really good thing. Because as I raised my hand earlier in the call, because we have a kiosk survey that is our visitor baseline, which is a total convenience sample. So that's something that I'm kind of still working with, just like data literacy and understanding that the results that come from COVES might look different than what we think our visitors look like, and that's because it's more accurate. So we're still kind of, I think we're at a place, actually this is a good opportunity for us because we have this kind of weird break. We're not anticipating and expecting what the results might turn out like. So I think it's making our team a little more open-minded in terms of what data might come out of COVES whenever we do shift. But I do wish that we had a little bit stronger sense of what our visitor demographics looked like coming in, just because I know, Jessica, at ScienceWorld, you're kind of in the same world as I am, where we have a lot of international visitors, and that's just based on me being on the floor and knowing that no one's speaking English, they're all speaking different languages. When you ask where they're coming from, they're saying international destinations. So I think we're gonna have a much more local visitation with travel restrictions, and it would be great to be able to kind of look at what that difference looks like, but we don't have that. So I think in the future it will be helpful, but I'm not sure when and where exactly how it's all going to pan out.
Hey, this is Robin from the fleet. I have a question for you. So we've been doing COVES for just a couple of months. The way it turned out, the people who were doing the surveys were all of our frontline employees. And like all of you, I'm sure we are cutting back on hours, skeleton crew. So my expectation is the only way we'd be able to go forward with this is by having volunteers trained to do it. One challenge we're having is in order to ensure distancing, we have more than one exit. We'll have more than one exit when we reopen, so we won't capture all the folks. But my question is this. Compared to a volunteer with a tablet asking questions versus meeting people as they exit and asking them for their email address if they would be willing, you know, to respond to a survey. What do you think would be more successful in terms of getting accurate information? Because I know, you know, it was really important, right, that people taking the surveys were anonymous, right? Because we wanted them to be completely honest. And it might not be that way if a volunteer is, you know, the one putting the information in. I don't think we're in a situation where we want to get everyone's email address who walks in the door, but the idea of asking folks, are you willing to share your experience with us? You know, are you willing to leave us with your email address? I think that's a little more doable. But I'm just curious, Ryan, you know, what you think would be better information.
So as many of us on the call know, this actually was literally what we piloted when we first started COVES, thinking about the data collection methods, the value of doing an email survey post-visit versus an in-person exit protocol survey. And we did see differences. To directly respond to your anonymity aspect of that question, it's totally possible to separate the email address that we send the survey to with the responses. So there's no violation of trust there. Whether or not the visitor understands that immediately remains to be seen. But we noticed drops in response rates. To Brett's point earlier about kind of the highly engaged visitor, people who saw, you know, Fleet Science Center in their inbox are more likely or less likely to click on it based on their perception of you. And so it wasn't the perfect system. Nothing is, but we found that to be not as effective in both efficiency and the ratings distribution as an in-person protocol. But that was all before, right? Like we did that pilot test in a world that no longer exists. Sure. And so I can't speak to the efficacy of a different data collection method at this point in time. These are all questions that, you know, the smaller COVES team is grappling with. Do we need to do a new pilot study? What does it look like, you know? And so that was part of the genesis of just thinking about what is data collection going to look like in the near future. So those are really good questions. As you can see in the chat box, there are a couple of other sites who have more than one exit and have handled that. We do have a couple of sites on this call who rely more heavily on volunteers for data collection, so we can speak to all of that as well. So all of those things we can kind of grapple with, but I think there's, what I'm hearing just from the first half of this webinar so far is this idea of, do we adapt our in-person methods to, you know, hand sanitize and use the iPad kiosk and possibly put up a QR code while we're doing that in-person random sampling? Or is there a shift to digital because most of us are doing time ticket entries and we have more information from our visitor in advance than we've ever had before? I'll just speak very openly from the perspective of trying to think about COVES wide. The hardest part about that digital piece is, even if 75% of sites have time ticket entries where we have email addresses, there's 25% of sites that don't and can't rely on that data collection method, which means we immediately lose the comparability aspect for the full system. So what we're trying to do now is think of the best practices that can apply to everyone, but we know how hard that is. So that's, you know, where we've started. All of the comments, I will say, are excellent so far, and it's been in line with what we've been thinking, but not necessarily perfectly, which is awesome, right? New ideas are great. But let's, for a moment, go off into crazy land and assume that data collection happens flawlessly moving forward. We figured it all out, right? All the questions are answered, the visitors are happy, we've got all the staff necessary, it's working beautifully. What information do we need from them? Brett and Elisa started talking about this. I definitely perceive a shift. Demographics are going to be important. I guarantee you, no matter what institution you're at, there's going to be questions from leadership about how does our audience differ from what we were pre-closure. And most of that is going to be related to demographics or zip codes or stuff like that. But there's this other piece that Brett mentioned about the experience of the visit. OER and NPS are still going to be really important. Those metrics aren't going to go away, but there's this whole other aspect of, did you feel safe? Which were the best areas of the museum in terms of safety, social distancing, et cetera. And I would argue that this does matter based on where you live in the country. Geographically, we've heard some differences, but I'm very curious from this COVES community, what are the core pieces that we need to shift to from a measurement perspective to give you all the data you need to move forward?
So I would say that Elisa and I have talked about this to an extent already and how we're going to come up with new data collection methods, but something that I could see being useful is maybe adding to or changing up some of the current motivation-based questions about why did you choose to visit the Science Center or your institution on this particular day, because I think there's going to be a shift there too, not just with perceptions of cleanliness or the new policies that we enact, but how people actually view us and decide to visit.
Right, can I raise something? I know I talk a lot, but can I just raise something that connects to this and to folks' hesitancy to begin data collection who have not yet started, right? So with any time that we like introduce a new question, right? Like there's something that I wanted to learn about a year ago, and like maybe I can start learning about it now, right? And so I would say that it's important to begin data collection, even though you might not have an immediate use or recognition of the use. Like it's important to get started because yourself in 6 months will thank you, like when you have access to data about your audience. But besides that, I know that there's a challenge of being able to compare to history. Like if you don't have history, then you lose that, and that seems like a primary benefit. But another major thing that is happening with us is not just comparison to history, but comparison to the national market, right? And that's going to be an important thing that we keep an eye on going forward, is seeing the extent to which our audience that we're surveying is like the very highly engaged, been here many times in the past, like the Science Center audience that isn't just visiting for the first time and discovering us. And whether or not that tracks with what we're seeing in either local or national market research about who's engaging in culture, who's engaging in cultural institutions. So anyway, I just want to put that out there, that there's also comparison to aggregate, market, and not just comparison to history, and following trends. One of the things that we're going to be looking for is the percentage of first timers, right? We want to track that very closely, not relative to history necessarily, but to see that as that increases, the percentage of people who are first timers, it's going to be an indicator to us that that we perhaps should turn our marketing back on, right? That we should shift back towards the full market and not just those that are hyper engaged with science centers. And so there is importance of this kind of data. And so I want to make sure to keep collecting it. And there are a couple of things that, perhaps we should speak about as an entire group or perhaps on sideline that I would like to collect so that I can further compare to the national market, like what other types of cultural attractions do you visit in a year? That's something that is particularly instructive data right now, as we see a lot of people shifting interest towards outdoor type venues, parks and zoos. and that sort of thing, and monitoring that over the next year will be another thing that's like an indicator to tell us that the market's coming back to normal, so to speak, if it is. So anyway, I want to put those things out there about data interested in, and how you don't need past data for that. I'm done talking.
Believe it when I see it.
I'm wondering about sort of, I was also thinking about this as you started talking, Brett. I saw Amber Kastner's on here from the Bell Museum, and they reopened, right? And like that was a huge opportunity and a huge moment, and there was a huge lift. So like, I'm not sure what data collection looked like there in the beginning, but all of us have this, we are reopening. Whether we make that into a celebratory spectacle or like a we're open and we care about you community, and like the sort of gentler is up to each institution. But there is possibly sort of this like, how do we track, are we meeting expectations? Are we open in the way that visitors are anticipating, and how do we respond quickly? And I'm wondering about that kind of bucket of questions, and whether that is covered with what's on the instrument or if it isn't.
I would agree with that too, Sarah. I think that to some extent, COVES has the opportunity to kind of be giving even some sort of like more formative type data to help our institutions determine like, what things can we already start to change based on the individuals that are coming to our space, which may mean that we're doing even more data collection in the beginning to be able to get enough to kind of inform those types of questions. But I agree with you. I think there's some space to kind of give that data to our people making decisions right now.
I was going to say, I also like agree with Sarah in her thought process, because we are a very hands-on museum, and I've noticed a couple of other people, like half of our museum is shut down. It cannot reopen because of the protocols placed in by the government. And so I'm kind of curious, because we're having to move to very hands-off, and we're having to do it like some of our questions have to adjust a little because our experience is going to be entirely different now from what it was. So that's something I'm also really curious in.
I think I can maybe add something small to what you were saying earlier, Sarah, in terms of our experience with reopening this brand new building, a couple of years ago. And I wish we had historical evaluation data to pull from that time period, but the reality is that it just wasn't the focus. And so, and I think we've been thinking about that a lot, that as we go into sort of this second reopening, knowing that we're going to be down so many resources, and knowing that through our connection to the University of Minnesota, a lot of decisions about processes and when and how those things happen are going to be kind of handed down to us, that we keep in the back of our minds that we need to do a better job of involving that process and collecting that data as we do this reopening. I think we mostly have been thinking a lot in terms of some of what Brett was saying, is that we really anticipate in the first year that the vast majority of the people walking back in our doors are going to be our members. We already have a lot of information on them. We already know they're a pretty homogenous group. And so there is a little bit of thought about, to some extent pressing the pause button, not necessarily knowing how much good information we can get from that particular group of people.
The thing I kind of wonder about, I'd say our expectations are probably pretty similar, that, we certainly expect our members to come back. And the survey we ran recently seems to support that. But I guess the other thing I'm wondering about is, I know I've seen a couple of things in some of the NAV studies sort of thinking about that sort of local, we don't know how much travel there's going to be, right? And, what is that local audience? A couple folks have already mentioned that on this call. because I'm wondering if there will come a point where there's still not a lot of travel, but people are doing a little bit more. And is this an opportunity to, engage more people in coming to their local institutions that they may not frequently visit because it's not usually on their radar, but they're not traveling, they're not doing other things. And so now these things that are usually lower on their list become on their list because there's just fewer things on the list. And what is the experience like for them? It goes back to Brett's question about looking at first time, how many first time people and how many of those first time people are local? How does, so it's just sort of, this is me talking out loud a little bit. It's not anything that's been a conversation and that I've been part of yet at my institution. And I'm not directly involved with the opening discussions right now, but it does make me wonder if our institutions, perhaps more so for those of us that aren't super dependent on tourists, where we already have a fair amount of local audiences, can we build on that a little bit more? And will there be things in the surveys that we want to explore because of that? Like I say, thinking out loud a little bit there.
That's definitely something that in reopening conversations for Space Center Houston, it was being passed around, kind of a, like, how connected do you feel to the institution? And is it something that you're feeling like it's part of a fixture of your community, things like that? So I think that's a really great question that would inform us not only in this moment, but also whatever the future brings, because I think that's a good read on how you sit with your people.
Yeah, it's funny. In some of the data that I think Elisa was talking about, in particular, one of the Wilkening stories that just came out, there's this question about, how and when will people start re-engaging with museums? And none of you on this call will be surprised with the answer. It depends, right? It depends on their level of comfort going out. It depends on their connection with the institution. It depends on, I think one of the nuggets that was taken away there between local members being a good core audience for reopening was how eager are people to get out of the house based on how safe they feel and how safe you make them feel. And then we get to comments like Marjorie is putting in the chat box about like big questions about what the museum means to the community and why they even showed up in the first place. So Kelley, your point about rethinking that motivations question was perfect, right? So if you haven't already and you've got thoughts that you don't want to vocalize, please feel free to put them in the chat because we're going to save that too. These are really good ideas, and these are going to be the hard ones that the COVES core team struggles with. There's a scenario where we pare down the core instrument so much that maybe it's just demographic questions, and then you get to pick 2 of the 8 modules that we create that have to do with reopening stuff, right? Safety, relevance to community, motivation for visit, i.e., what does this museum mean to you? So none of those ideas are off the table. This is a huge moment for us to think about what that means. I do want to take a moment here to just acknowledge that one of the big unspokens, even though you have said it, it's just in different words, is feasibility. We all know that the data are going to be hugely important. I mean, whether you can connect it or collect it or not, these ideas have come up about who's going to visit, why are they coming, who are we missing, all that kind of stuff. But at the end of the day, if we don't have the staff or the finances to support it, it may be one of those really nice to haves that you just can't support in your very earliest reopening efforts. Having said that, I want to encourage all of us to think about strategies that will facilitate data collection rather than just saying we can't do it because we laid off a lot of staff, because every single one of us are in that boat. And it's going to be flat out, it will be a struggle, but I think it's going to be more important than ever as we start pushing past the we just reopened to, we're reopening with grandeur, or we're seeing our attendance numbers start to go up. So that's kind of where this is all headed. The protocols to make sure we can do the data collection safely, the questions to make sure we're providing new information that helps us all do our jobs better. And then, beyond that, how we can keep this community alive, because as the last 2 months, as today and last month have shown, this is a thriving community where we come together for ideas about what museums look like, a month or 3 months or a year from now. I feel like I saw some hands or something happening while I was talking. Nope. Stunned silence.
Well, I'll say some things if you want.
I do.
I don't know if I have anything super novel to add. It's been really helpful just to listen in. I'm Juli Goss at Crystal Bridges Museum of American Art in Bentonville, Arkansas. Very different scene here in Arkansas. So reopening plans are probably much sooner than maybe everybody else on this call. Also, art museum plans, I think, are just different than science museum plans from the nature of our work and buildings. And so I am really thinking about what data collection looks like. It's been a combination of all the things that you've said. I have my 3D designer like building an iPad stand, or she drew me a picture. We're going to talk about how much it costs. Because we can't just buy one off the shelf, it has to be on brand, guys. It might be an iPad stand. It might also have signage on it with a link or a QR code. It could have a trash can and storage space for gloves or other things. We're working it out. I don't know the answers. I want them from you. I think it's something that I'm happy to share whatever we move forward with, or I want to learn from y'all. And then the other piece, I think in terms of questions that we can add, yes, I love all that y'all are saying. I think the role of art in our world right now is something that we're talking a lot about. We're also doing this huge community engagement initiative. So that's just something that will continue to be important. I think looking at age breakdowns when people come back, you know, there's all this data saying that younger people are going to feel more comfortable coming out and being active, thinking how to do that well, not just from respondent, but group ages as a whole. Super fun data to tackle. So if you guys want to help me make better claims, that would be more informed claims. That would be great. I think that's going to be a piece. Demographics has always been important because we really want to see who is coming from our community, and actually all this work that we're doing that in our communities right now. I just wonder what impact that might have on our future visitors as well, and visitation. So yeah, those are all my thoughts, and I'm excited to be a part of these conversations. I personally haven't thought much about switching to a digital form of data collection. It was all about augmenting the in-person because I wanted that consistency over time, because we did have an ongoing study for 4 years before that. So that's just my thoughts, but excited to figure it out together. And since I'll probably open before many of you, I'm happy to test out any ideas for us. Yeah, Arkansas is just, we're very grateful for what's going on here and feel for everybody else. And yeah, I'll just stop talking now. Thank you.
No, that was great, Juli, because you did start talking about some ideas that have come up in other conversations that may not be mentioned here. You talked about a wastebasket for maybe plastic gloves. Someone did mention the idea of like a cheap stylus, but maybe you give something to visitors when they enter the museum that allows them to open doors and also respond to a survey that they don't have to touch, that's on brand. I didn't even think about 3D printing a stand. What a great idea. I mean, not all of us can do that, and I don't even know what on brand means. For those of you who are thinking about that as a potential option for, you know, posting the iPad, you can purchase them quote unquote off the shelf for like 150 bucks online. If you did want to go the cheap stylus route, it looks like you can order them in bulk for roughly 50 cents with customization. So these are some other things that have come up. Social distancing, obviously, not just between visitors. You've all mentioned it, between visitors and staff. So thinking about maybe putting some visual cues about where safe distances are when you are doing surveying or when you are doing data collection will be important. And then again, this transparency of the cleaning protocols. So like hand sanitizer stations, positioning yourself next to a bathroom so people can actually wash their hands with soap and water. Just some ideas, but you know what we're pushing for internally is to kind of come up with all of the exhaustive options and then think about what a recommended plan would be. the kind of goof that we talked about most recently was a flow chart or choose your own adventure. You know, if your local government says this, you should do these 4 things. And if your local government says that, or your building administration says this, you know, here are the recommendations. Again, I can see it in chat and I can hear it in the conversation. There's going to be a big distinction between, can we offer the same COVES experience where we have standardized protocols across sites, or do we need to offer more flexibility? A key point to remember that no matter how visitors access the existing survey, we get some kind of metadata that says they scanned the QR code, they entered the bit.ly, they did it on your iPad, you know, so we'll be able to track some of those differences across sites if we worry about comparing to everyone else or aggregating. But we want to have all the options on the table as we keep talking about. And I hope everyone is hearing on the news, flexibility is going to be really important. And that's entirely true here. My biggest concern is making sure COVES exist to support all of our institutions beyond, you know, well into the future. So we'll keep brainstorming this. I've talked a lot too. We've got about 5 minutes left. Alex, Sarah, I don't know if there are any more guiding thoughts you'd like to enter, or if we should just open it up for, you know, remaining comments or questions.
I guess one thing that has been, I haven't heard directly addressed yet around data collection is kind of a mushy thing, but something like the sticking point that I get to actually is, you know, I think we've come up with a lot of really good concrete ideas about like iPad stands and styluses and gloves and like kind of the nitty gritty material things. But for me, there's still a little bit of a sticking point around the social moment of approaching a visitor. Like approaching a visitor group, getting their attention, because, you know, post COVID, I don't know if anyone else is experiencing this, but if you just start to come into proximity with another person, you feel like, yeah, Brett did the arms thing, like this moment of threat, right? And it's already sort of hard sometimes to kind of like, you know, easier for some than others, but to kind of get up the, you know, the momentum to go approach somebody that you've, you know, with your random sampling. But when that person is then like maybe immediately threatened by you, like, yeah, I just wonder how to solve that. And so I think there are definitely ways to do it. So maybe this is a question for Juli, as you're like the first one to reopen and working through in-person data collections. I feel like in-person at the Museum of Science, I feel like that is probably the way we will continue to go as well. Try to make that work before trying to shift over to completely digital things. But I think that little mushy point about the social interaction is going to be big.
And I would add to that, Alex, too. I think it's like thinking about it from both sides too, from the visitor being like not necessarily expecting somebody to kind of come up with them or approach them to do this, but also what strategies we can use with our data collectors to also help them feel comfortable in doing some sort of approach, whatever safe way that we figure out that looks like. I think it's going to be important on both sides.
And just throwing out there that I've been thinking about that quite a bit, as well as a larger constellation of our front of house training, because we're also anticipating that we'll need visitor experience staff to approach visitors about following the rules a lot more than we have in the past, or potentially de-escalating conflicts between visitors who perceive each other as not following the rules. So to add into that mix a positive interaction feels especially challenging. And but I would just give a shout out that I feel like trying to think about something like that, again, in the constellation of all types of staff training, has helped us at least think about it from multiple sides, that you know, those things go together and don't happen in a vacuum, or those visitor experience moments don't happen in a vacuum.
Those are really good points, Rachel. I didn't even think about the different types of staff to visitor interactions that might be necessary moving forward and how data collection will play into them. At the Museum of Science, we've started talking about limiting the number of staff facilitated activities on the floor, obviously. So just not seeing as many, you know, red coats, the museum staff or volunteers interacting with visitors, and then putting this whole new dynamic into play is something that I quite honestly have not even thought of, and is saddening a little bit. Yeah. Sorry, I'm looking at the comments. Beth, agreed. Someone else brought up the 1918 pandemic, and I was like, doesn't matter if we have data from that. That was 100 years ago. What? Come on. But okay. So, any final thoughts? This has been really a really good conversation. I'm thrilled with it. So, I hope you've gotten something out of it. Any final thoughts as we wrap up the hour?
Are we still going to have an aggregate report for July to March, or?
We still have a lot of data.
Yeah, I mean, I guess I would hope we have a.
With a giant asterisk on it that says not
Well,
COVID.
Cut it off in March, or don't do March. Do it through the end of February, like whenever normal ended, I think, or maybe just July through December. I don't know. I would still think it would be helpful to see that pre-COVID.
Yeah, the intention is to do that. I guess we could start on it now.
No pressure. That was not a demand.
No, I just mean like the date we're not going to be open, so why not? Okay, so I love the idea of recruiting through staff wearing sandwich board signs too. I'm envisioning the progressive commercials with the guy with the spinny arrow, and then he's just pointing at stuff.
Not sure I'd get my staff to wear them, but I'm not sure I'd wear it. But hey, it's an idea. Big QR code on it.
Car dealership inflatable.
Yeah.
Like some sort of Statue of Liberty hat or something.
Yeah. Okay. Well, this has been awesome. I want to thank you all for taking the time to come, share your thoughts, listen, even if you weren't on video, and hopefully there's been some stimulation that happens in thinking about what our museums are going to look like when we reopen. We did record this. We will be posting it to the website at some point. YouTube. So if someone missed it and they want to be able to check it out, we'll try and do that. And we will definitely engage again in June. So if you've got thoughts about what other topics are going to be really critical, because I don't think many of our museums will be reopened before then, unless you're in Bentonville, Arkansas. We have an opportunity to keep these conversations moving forward. So definitely let us know what you want to hear.
Thanks so much.
Thanks.
Thank you, everyone.
Thanks so much.
Great seeing you.